Predicting what's next in healthcare, the Disruptor's Viewpoint, how a popular web platform is connecting doctors and patients and hoping to save us time and money along the way. I am so pleased to welcome Oliver Kharraz, the co-founder and CEO of ZocDoc. He is here with my great colleague, Steve Clemons, Atlantic, Washington editor-at-large.
Great, thank you very much, Margaret. Thank you.
Thank you.
Hi, everybody.
Hi, how are you doing?
Oliver, thanks for joining us. So
Thanks.
let me just start at the obvious place, which is where Daniel Kraft left. You're the kind of Uber of doctors, right? Basically, is that, or are they the ZocDoc of transportation?
Well, yeah, we were there first, but
Okay.
it took us a long time to get started.
I probably touched a sensitive point there, right? So,
Truthfully, I mean, in Arizona, I don't know what the right service is to use. Is it Uber? Is it Lyft? It took me a long time to get my Uber. Nearly got late here. But
me too.
But what takes even longer is getting into a doctor. So the average wait time to see a physician is 19 days in this country. That is the reason why we got started, because that's utterly too long. By that time, people go find other modes of care. They go into emergency rooms, urgent care, etc., and it's completely unnecessary also. You can go to ZocDoc, you can research your doctor, you can find out who accepts your insurance, and you can book the doctor 24/7, right from the privacy of your phone or of your desktop. And the typical appointment on ZocDoc happens within 24 hours.
And I know it to be true because I've actually done it. Since the last time I spoke to you, I've done it with a doctor I was seeing before, but it was so much easier to see him without a human involved. And it takes me back to what Daniel was just sharing about the future of medicine. And when you think about diagnostics, you think about a lot of the, I guess it's beyond inefficiencies, but
Right.
the mistakes, the gaps, the problems in medicine, that technology seems to be coming in to fix a lot of this, to the point where maybe we don't need doctors, we're going to have robots. So will ZocDoc be dealing with robotic doctors at some point?
So look, I don't know. So there's a question on how far this mechanization actually will go. I think in the US, as the medical community, we have allowed ourselves to be typecast as the analytical guys that just find out what the right answer is. And I think we have gone back on the original promise of being a healer, someone who is really a partner to the patient and who can have that relationship on a basis where we actually help the patients to do the right thing. I remember from my personal practice that at some point the pattern recognition gets to a point where you know what the patient has, but now the game becomes, how do I help this patient do what's right for them? That's actually a completely new type of science that we can now start. I like to call it evidence-based messaging. It's a little bit like evidence-based medicine, where we
Messaging to the patient?
To the patient, right? Evidence-based medicine figured out which molecules change our metabolism in a way that we like. Evidence-based messaging should find out which messages change our motivation in such a way that we can cope with the behavioral-induced issues of chronic disease and non-compliance. And I think there is a huge area for us. And I'll give you one example where ZocDoc can be helpful in that, because we have a closed-loop system, right? So patients book with us. We then send them wellness reminders saying, hey, some point in the future I'll turn 50 and say, happy birthday, Oliver, it's time for your first colonoscopy, right? And we can then figure out how that message needs to be constructed for me to actually go and get that colonoscopy. And because we can follow that appointment as it's booked, we know which message works on which type of person. And we already know this today. Like for some people, you need to be...
What message might work for me on that?
Well, that's patient confidential information. We don't discuss it in public.
But I think that when you talk about that, I think one of the things we're going to be getting into with everybody today, and hopefully with all of you in terms of Q&A, is literacy. I mean, health literacy among the population and what they know. And I sometimes wonder it may go beyond messaging, because the sort of world we're moving into, and even within ZocDoc land, if you get in and look at how you're creating sort of new and more efficient methodologies for people to access care, it kind of presumes to some degree that they haven't already fixated on certain doctors or certain pathways, and you're changing that game. So how much is literacy required in this? Because my sense is that literacy is a challenge. Am I wrong?
So look, anything that is complicated requires a good amount of time. The question is, how do we help the patients that accept guidance to actually get to the right results and actually help them act on it? One thing that I would like to share on that, and that might work for you also, is we have this well guide that tells you what percentage of your recommended preventative screenings you have already done. And it's based on your age and your sex and your medical history that we know of. And what we do is we show you the smile. When it fills up, it's if you do everything, it's 100% in green, and if you do only half, it's 50% in orange.
This is a new thing.
So we've done this.
Smile. Tell them about the smile.
So the smile, well, this is part of, that is the logo, that is a separate thing. But the smile, now, just to finish that part of the story, the smile, what we found out is if I give you the full smile, and then as I introduce the things that you haven't done yet, I take away from the 100%, I can double the rate at which you're going to act on it. You know, the double the rate at which you get that screening, the other screening, that without paying $1, without creating any complicated incentive schemes, without any of that, just by tapping into what behavioral economists would call loss aversion, because you already knew you had the 100%, and all you need to do to get it back, you know, your 100% that you had, is to do these two things that are actually good for you. That's the stuff that works at any point.
And you have some data to show us, in fact, on some of that, the time spent as consumers looking for healthcare. I don't know if those are up yet because I can't see them. Do we have your slides up? Oh, they are up, so we're already talking about them. And when you look around, I don't see the Phoenix numbers here, but when you look at the amount of time people wait for appointments, it's a staggering. Is it really 66 days in Boston?
Absolutely. So I assume the map is
Anybody
up.
from Boston? Anyone at all know you're all in Phoenix so that you can get to be seen right away?
So this map shows you the experienced wait time for a consumer that picks up the phone and tries to call around to get a doctor to see them. That's from the time they have the intent to see a doctor till they're actually in front of a doctor. 66 days, that's more than 2 months, right? No one should think that this is an acceptable time to wait. The average for the nation is 19 days. Now, on ZocDoc, even in Boston, you can see a doctor within 24 hours. Now, how is this possible? It's possible because there are so many last-minute cancellations, no-shows, and reschedules in a doctor's calendar that there's an enormous amount of waste. We like to call this hidden supply. And we surface this hidden supply and make it findable by consumers, and they can just go on the website, find the doctor they want to see, and click to book this appointment 24/7. It's an enormous win-win-win situation for the doctor who gets his time taken up, for the patient who gets to see the doctor sooner, and for us as a society, because these patients then don't end up going to the emergency room where they cost 5 times as much money.
I went on ZocDoc this morning to look at primary care physicians in the Phoenix area. Lots of 5-star physicians, some 4-star physicians. Yeah, you know, but I began looking through them and look at the grading system that people were providing and looking at the patient feedback. I guess I have 2 questions. Is one, do you see doctors responsive to those? And 2, I saw this poor guy who just kept saying, hey, I'm an urgent care doctor, I'm not this. And so on things like bedside manner and various other sorts of things, he was getting whacked by people that were expecting this wonderful experience from someone who was in urgent care. So when you look at that and you look at people grading a doctor and having a real impact on his or her standing in a community, do you help guide people on what they should be reporting on? Because I'm not sure that the guy who was the urgent care physician, I don't know if he's here today, was graded right.
So I'm not familiar with that specific instance. We do give some guidelines, but they are the usual guidelines: no profanity, it's a family.
But do doctors change their game if they see negative impact?
Like doctors will call in about reviews, and I have an interesting story to tell you actually about how big of a lever it is to change doctor behavior if we just put it out in the open. So we have a product that we call ZocDoc Check-In, which is essentially personal health record. And in order to get it working, we needed the doctors to send in their medical history forms, these paper forms that you need to fill out when you go there for the first time. Well, we put a nice large button there. We made it really easy to upload it, and we waited, and we got maybe 20 doctors to upload these forms. And we did a big spreadsheet. Okay, how many calls would it take us to get the remaining tens of thousands of doctors on? And we said, that's not possible. So instead of calling all these doctors or trying to find monetary schemes to incentivize them to do it, we created a badge. We called it the Rapid Registration Badge. And it's 20 by 20 pixel, completely free. We put it on the doctor's profile. And lo and behold, within 6 weeks, we had 80% of our doctors uploading these forms, because the first one had the badge, the next one figured out how to get it, and then it became this self-fulfilling prophecy. And I think that's where we can really see doctor behavior change on a big scale. To your original question is how was this guy rated fairly? Well, I think what we find time and time again is that patients really care about the bedside manners of a doctor. And I think, yes, how much time you have plays into that, but it's really not the only factor that determines your bedside manner rating. And I think as doctors, as healers, as someone who's committed to making the patient not only function but also feel well, I think it behooves us well to make sure that we deserve a good bedside manner rating.
Now, one of the things that I think you and your colleagues that started ZocDoc were doing, and I was just reading, this is your 100th day as CEO, right? You were co-founder, but now you've been really running things. And you've been trying to fill in some of the gaps or deal with some of the tense points from Obamacare. So how has Obamacare either helped your business or hurt your business?
So, I mean, ZocDoc existed prior to
Right.
Obama being a hot candidate for a presidency. So, there was a pre-existing access issue in this country. This is why we got started, because it takes so long to get access to a doctor. Clearly, we are founded. Our mission is to give power to the patient. Our mission is to improve access, and anything that helps with that, we are supportive of. Outside of that, I mean, there is an informational gap, and we did work with the White House to make people aware of their options and make sure that things work. But I think this is in many ways more a recognition of the fact that ZocDoc has a large base of consumers that are interested in their healthcare, that are engaged digitally, and how do we leverage this for all kinds of things, maybe for Obamacare, but maybe also for just better population health outcomes, for better targeted intervention with the right patient, to make sure that we, as a society, experience the best results possible.
How do you keep patients in the center of this process when doctors are really your clients?
So our number one value is patients first. You walk into our office, that's big in large letters on the wall, and we use it everywhere in our reviews and our decision processes. It's something that comes up all the time. I think it's very important for that to be the true DNA of our company, so I feel that I'm part guardian of that. I think it's the right thing to do. As a physician, I feel that. I think it's also the long-term strategic thing to do for a company, because patients are going to recapture a lot of the momentum in healthcare.
So I'm going to put you on the spot for a minute. I'm sure you're going to give me a nice answer. But whenever I've seen these things in the past, particularly in the software world, but you get out and you're grading different players, or you've got tweets rising out in the political Twittersphere, people can pay their way to the top. And paying their way to the top so that they've got branded status and priority over all other things just seems to be part of the national pathway of the software side of Silicon Valley. Is that, although I know you're in New York, but is that something that you're struggling with? Are people trying to pay their way to the top in terms of doctor rankings or status? Is that something you worry about?
I'm not worried about it. And for us, our growth engine is our health systems business that has grown, doubled year over year for the last 2-3 years, and is actually on track to do more than that this year. And they look at it as a portfolio. They have hundreds of doctors, thousands sometimes, and for them to have like any given doctor on top of the list isn't really the most relevant piece.
So you're not worried about it?
I'm not worried about it.
So what is, when you think about the health care terrain which we're out there today, and you've wired a significant part of this, and going back to the presentation, where, I mean, it's so fascinating. I kind of get lost in the kind of the world we're in. I said, that would be really cool that if you go to, DC, we're trying to regulate death. In Silicon Valley, they're trying to end death.
Right.
And there's a kind of coming strategic leap in what's possible in health. And I'm just interested in when you think about your own company and your own stakes you put into this, what does it look like for you 10 years from now and 20 years from now? What will are you going to be doing the same thing, essentially brokering patients and doctors, or do you have a glide path that fits with some of what Daniel just shared? I mean, do you look at that as a vision that we're really moving towards, and how are you going to fit into that?
So I would be very surprised if we did exactly the same thing 10 years from now. What I think is going to be a constant, though, is the patient. And with that, all the aspects.
So patients will stay human and there, but doctors might not.
So doctors doctors will probably also stay human. They will just be doing different things than they're doing today. I believe that the key to actual progress for the types of diseases that are dominating our healthcare systems is going to be behavior. It's going to be getting the patient's buy-in, and I think that will be part of the role of physicians, but it will also be part of the role of technology to actually enable and facilitate this and make it a real science. And so for that, I think Google Glass was mentioned in the previous presentation as an example. That's a prime example of a technology that didn't get adopted because we need to think about the anthropology of providing healthcare also, not just on the technology that enables us to do one thing or another. And I think that's an area where we have collected enormous expertise and we'll continue to invest in.
So you're dealing with about 5 million calls a month right now, is that right?
Yeah, roughly, yes.
So roughly 5 million calls a month. So you're sitting behind the screen and you're seeing what people are chasing, what they want. What are some of the biggest features? I mean, humanize this for me and tell me what are people, when you look at those 5 million requests and calls, what are they most prioritizing? What do you see in healthcare that someone like myself is not seeing?
So I think the answer is always it depends, right? There are two, like on the highest level, there's two different types of users. I would call them maybe convenience users and searchers, where one bucket just takes the first doctor that's available close to them and accepts their insurance and they're done. And the second bucket literally goes in and pre-meets these doctors nearly. It reads all these reviews, like the current record holder is someone who read 53 doctor profiles with all the reviews before making an appointment, which is a tremendous amount of research that goes into that, and clearly it's a long-term relationship. I think there's that. And then after that, it becomes very, very granular. I can tell you that in New York, no one is willing to cross Central Park to see a doctor. Very different story in Houston. And it's the willingness to travel depends dramatically on where you live, what time of day it is, which day of week it is. The affinity to a certain doctor will vary on your race, the doctor's race, and similar factors. And I think one of the interesting frontiers for us is really to figure out which patient is going to connect with which doctor so that we increase the chance of them actually being compliant with what best practice care is.
Fascinating. Do you go across the street or do you go across town to your doctor? Across the street. And you insist on, and do you know your doctor or you do look them up on ZocDoc or some other service?
Usually I'll just do a search, like filter searches to my particular area.
So this is I'm sorry to do this because I know there are millions of people watching online and I should have a mic at you. Yeah, bring the mic up to her. This is interesting. I want to.
You'll stand for us.
I knew you were going to be a data savvy health buyer, right? So, but you go local, you go across the street, but then you put a filter on for someone who's across the street.
I put a filter on probably 10 miles radius. I live in Scottsdale, so I won't go out of Scottsdale. Then I also have other filters as well as a medical doctor, but I'm into wellness, so I want a physician that practices both. And that will take my insurance, because wellness physicians don't take insurance. So I think it's a very great idea. I've been on ZocDoc before.
Thank you.
So let me ask you both a question, and then I want to open up to everyone, because the big issue for me as I think about folks I've known who have been engaged in medical needs is, again, literacy varies a lot, often varies around the country. And the second thing is, did she take the microphone away? Because I'm going to ask her a question. Is that when they are engaged and there are these literacy challenges, the other part of that is that technology is changing the field so dramatically that many people think they know what they want, what they need, but the technological advances are piling on so fast. And I'm just wondering, in a world in which you're trying to shape this around the patient, and I'm just wondering whether there's an institutionalized, and I don't mean this in a negative way, ignorance in the patient, given what flood and tsunami of opportunities and changes coming. So how are you, are you open to change and difference in technology and new and different pills and methods?
Well, I think technology brings, we as humans, we have our own preferences. So I don't want anybody to tell me where to go. I want to find out where I want to go to my preferences.
You're way too literate for me. No.
Well, the power of the internet and search engines and also filters,
right.
You can literally go on and find your location if you want a male or a female doctor, and what type of doctor. So there's a lot of different aspects in each person. And now with the internet, we are educating ourselves much more. So now that we're more educated, we know what we want. So to have an ability to find, to have this access where we can pick and choose what we want, because how many times do you go to a doctor and you're just very dissatisfied?
Put Tina in a ZocDoc ad.
So
But-
anyway, it's a good
but-
tool for the internet.
So let's say we had somebody kind of less with it than Tina, and kind of walking their way through technology and what's happening and how the whole field is shifting. What is your experience with that? Because I know myself, I told Margaret Lowe Smith when I joined the Atlantic, healthcare and education events were the ones I least liked because they scared me the most. So I'm actually the illiterate consumer of health. But when you look at that and you're trying to overcome that with the patient, what are some of the methodologies and stories in which you've fixed you've bridged those problems?
So first of all, it needs to work in such a way that you don't have to be a PhD to use it, right? Because it's not as if the pre-internet world was so much easier or better to use anyways. What we do is we actually go and vet every single doctor that's on ZocDoc, so we make sure that we're actually stricter than the state's licensing boards in terms of a doctor coming on ZocDoc. So what
You kick doctors off?
Absolutely, yeah,
Cool.
we do.
Do you have
So
a hall of shame?
we don't have a hall
Or
of
they
shame.
just disappear?
They may just disappear.
I see.
But it's an interesting idea. I always thought, as being German, that I have more punitive ideas than others, but that's very funny.
You have no idea.
I see. Well, but we see ourselves as mostly self-guarding, guarding the patient, right, and making sure that the objective quality criteria are met wherever they end up seeing. The second most important piece is actually for the patient to relate what's going on with this doctor. I'll tell you, a story from the early days when we had mostly dentists, and there was this review coming in about a dentist, and the review said, "Oh, I walked in, like I sat in the chair, dentist walked in, didn't say a word, just did her job and walked back out." And I said, "Oh my God, this dentist is gone. Like there's no way any other patient was going to book with this dentist." Well, it turns out I was dead wrong. Because there's
Exactly the kind of dentist I like.
Precisely. There's lots of people who don't.
Unnecessary conversations.
So you'd
yeah.
be the patient that books with that doctor, right? And it's the right doctor for you because you don't want someone talking to you when you can't talk back because you have all these utensils in your mouth, right? And so that's and I think there's
So this dentist business skyrocketed.
Well, I think he got the patient that were the right patients for that practice.
That's fascinating. Let me open up the floor for the comments. Yes, right back here. This lady right here, and we've got a microphone for you.
Hi, I'm Mitzi Krockover. I'm director of the Health Futures Council at ASU. One of the challenges, I think, in terms of, I don't know about your site specifically, but health grades and some of those others, is that they're really, the rankings are really on kind of everything but clinical outcomes. So do you see a way for us to, at some point in time, I know that we're starting to see it in hospitals in terms of that, and you can get that data, but you really can't get that data with physicians, and you certainly can't get it specifically from the patients themselves, other than anecdotal. So would like to hear your views on that.
Yeah, absolutely. So I agree with you. The clinical outcome data would be the holy grail, for the way stats works. We probably will never get it on an individual doctor level. So if you put outcomes away, like what are the other options we have? Well, I think the two other options is guideline compliance, and we can try to figure that out, but it doesn't really tell you. I mean, it's correlated with the outcomes, but it's not necessarily the same thing. The next dimension that we have is, well, how likely is this doctor to create a connection with this patient? And that is an indicator for compliance downstream, which we know is another big bucket, separate from the doctor quality, but another big bucket of missed healthcare outcomes. And that's where we excel, right? Both in setting up the right match between the patient and the doctor because they get a chance to pre-meet them, and because we actually make sure that that part of the review is real. So like, unlike other sites where anyone can leave reviews on anyone else, we only allow closed-loop reviews where we actually know the patient booked with the doctor and showed up and has actually seen the doctor. This way, it's not a competitor leaving a review on someone.
Fascinating question. Yes, sir, right here.
David Edge, American Retirement Advisors. ZocDoc, as we are becoming more educated because we've got analysis by paralysis, because there is so much information on the internet, how is ZocDoc helping with people that are seeking chiropractic care, naturopaths, et cetera? Because as we're aware of, a lot of insurance policies and companies don't cover naturopaths.
Right.
So it's becoming a bigger and bigger issue, but how does ZocDoc deal with that?
Great question.
So we have chiropractors and naturopaths on the network, on ZocDoc.com. If they accept insurance, you'll be able to see that. If they don't accept insurance, you're pretty much where you were before, except that you now can book an appointment with them. So we obviously are not an insurance company ourselves, so we're not extending your coverage to doctors that don't offer that. But it will be easy to find them to the extent that they are around.
Do you think, I mean, just to piggyback that, and then I want to go to this gentleman here in the middle, but do you think that you providing a platform and bringing in a whole variety of different pathways to health actually changes the field, that it becomes that you've created an efficiency and awareness that didn't exist before? Are you seeing that happen?
Yeah, I see a couple of things happen. First of all, it's easier for doctors to strike out and become independent, and it's easier for them to work in the way that they want to work. So I have one of my friends who's also a doctor on ZocDoc. He literally decides on Thursday night whether he wants to work on Friday. And he knows if he puts his availability for Friday in, he's going to be booked for Friday. And so if his kid has a school performance, he doesn't do it. And if his wife and his kid are somewhere else, then he works all weekend. And that sort of actually enlarges the pool of doctors that we have at our disposal, because they can now be more flexible. But who wants to think 2 months ahead of time where they're going to be on any specific date? I'm a pretty organized guy, but I can't even do that. And so we are asking our doctors to really tie themselves down when they end up having only 70 or 60% utilization on that day. So I think that's definitely a change that we see happen.
Yes, right here.
Thanks for being here. Varesh with 4C Medical Group. We're an internal medicine practice in Scottsdale.
Are you on ZocDoc?
We actually are. We just got a new provider and we just signed him up for, it's not me, I hope. No, it's not. Thank God. I have the exact same ringtone. So, I have a couple of comments on this whole issue of reviews. And part of the responsibility of a physician, I'm sure there's some physicians in attendance here, is to tell patients what's good for them, which may not necessarily be what they want to hear. And we've had some personal experiences. I, as a CEO, take my reviews very seriously, and I am a proponent of feedback from consumers. However, we have had at least 3 or 4 cases where we have gotten reviews, bad reviews, and we investigated and put a lot of time and energy and resources to get to the bottom of what the issue was. And there was cases of patients that did not have established relationships with their physicians, found us through, just a directory, or maybe in ZocDoc that happens too, when you don't really have a relationship with a physician. And there were drug seekers. And we have a very strong policy on not entertaining drug seekers, and there's documentation to prove that patient came in, wanted to get prescription refills on substances that are controlled, and the physician did not believe that to be prudent and told the patient accordingly. And that resulted in a bad review because the patient didn't hear what they wanted to hear. So my question to you, as somebody who influences this, is there ought to be some sort of filter mechanism built in when you're dealing with consumer reviews in healthcare settings, because it's not just buying a product and saying, hey, it doesn't work right. It's a relationship thing. And if people read a review without knowing the background, then it may lead to false perception in terms of what the actual services
So we're going to let him answer, but before I do that, just real short form, when you look at the overall number of reviews you've received, how big a portion were those 4 negative reviews related to drugs compared to everything else?
So we also work in hospital settings, and that's an interesting question, because if you look at statistics, people that have bad experiences are more likely to leave reviews than people who've had good experiences. HCAHPS is a national...
Welcome to the airline business.
Same thing with hospitals. Patient experiences, people get to rate hospitals, and we have tracked this, and it's much more likely for a patient who's had a bad experience to have a review.
Have you thought this through?
Yeah, so a couple of things. First of all, the ask for a filter mechanism for these bad reviews. In some ways, that's already in place. Amazon has provided that to us. We have the educated consumer. They know how to read these reviews. And what we've actually seen when we look at the statistics, the 10% of our doctors that are the most successful, that get the most appointments with us, have all at least one or more negative reviews. That makes these reviews credible. And the actual consumer that ends up reading them knows that there's a mix of people leaving reviews as well as so they're a reflection on both the person who wrote it and the person that's being reviewed. And so it actually helps your utilization to have a couple negative reviews as long as they're not predominantly negative. In terms of the rate of people that actually leave reviews, we see roughly 20% of patients leaving reviews for us. So it's much, much higher than in most other systems because it's easier to do on your mobile device. And so I think it's a pretty representative sample, and we actually see what I believe is the case, that most patients have a good relationship with their doctors and they rank them highly. And so from that perspective, I think the reviews are a good indicator for when you see them in their breadth as to what the experience is likely to be.
Fascinating question. This gentleman right here, we'll take these two.
Murray Feldstein, a retired physician, now a visiting fellow at the Goldwater Institute. And my area of interest is how medical licensure may restrict access and be an obstacle to our future progress. For example, interstate telemedicine would be one example. But my question is this. Uber kind of wrecked anybody who was a taxi cab certificate owner. It might cost that fellow $100,000 to buy his certificate. And Uber kind of liquidated that in New York City. Are we looking at something like that? Is a disruptive force going to make us change the way we train and make our physicians and healthcare providers, nurses, pharmacists more easily available based on the skills they can bring to the marketplace?
Interesting question.
So I don't think that's going to happen because unlike Uber, the patient actually cares about who treats them. So we see that when patients come back to book again in the same specialty, 3 out of 4 pick the same physician they have seen earlier. And we also see that a physician, for example, that has time on a Tuesday, but also on a Saturday morning, is more likely to be booked than one that has only time on a Tuesday. Why? Because this patient, when they get to know this doctor, they think, oh, this is great. I have the optionality of seeing this doctor on a Saturday, and so I'm going to pick that. It tells me that they are already thinking about a long-term relationship, and it's something that we at ZocDoc really want to foster also, because there is a lot of, it's more relevant to be seen by the same person and for them to know your entire history than being driven by the same individual. They really only need to know where you're coming from, where you're going.
Oliver, this has been fun. We need to wrap up, but I need to ask you before, because you've just done this big redesign on your website, and I was looking on my iPhone this morning, and you've got this, the face is sort of a Z with these little 2 eyeballs. Now it's animated and it moves, and it's sort of scary in a friendly sort of way. But
Right.
How does it know? Because sometimes it's smiling and sometimes it looks sick. How does it know?
So, see, this is the next wave. This is telepathic medicine, like the iPhone already knows. Now, so it does that based on what you're looking for.
Ah, okay. Yeah, it went from happy to sad very quickly. And, I thrive in darkness. Anyway, good to see you, Oliver. Thank you very, very much. Thank you. Oliver Kharraz with ZocDoc.
Thank you.